Ever wondered how doctors remove polyps from your body during a procedure called polypectomy? It's a minimally invasive surgery designed to remove abnormal tissue growths, often found in places like the colon or stomach. Here's how it's done. The patient is first sedated to ensure comfort, and a thin, flexible tube called an endoscope is inserted into the body, equipped with a tiny camera to guide the doctor. When the polyp is located, a special wire loop or snare is used to encircle and cut it off, often with a gentle electric current to minimize bleeding. The polyp is then carefully removed and sent for analysis to check if it's benign or needs further attention. The entire process is quick, usually painless, and most patients can resume their normal routine the same day. It's a simple yet life-saving procedure to ensure your health stays on track.